This year's World Cancer Day is closing the care gap. And this really hits home, especially in low and middle income countries, because what we realize, and if we look at projections, we see that by 2030, three-quarters of all premature deaths from cancers are going to be from low and middle income countries. And what we see in our countries is not only are our patients diagnosed with advanced cancers, they frequently do not complete their care. When we look at the reasons behind this, we see a constellation of a couple of factors, but the three main barriers are: one, around financial factors, the fact that patients have to pay out of pocket in order for them to access their care, frequently resulting in financial toxicity and catastrophic health expenditure. And the second sort of big barrier that our patients face is the health systems. On average, patients will engage with at least 3 to 4 health workers or healthcare providers in sub-Saharan Africa before a definitive diagnosis of their cancer is made. And this results in delays in the diagnosis and subsequent therapies. By the time they are having their cancer diagnosis done, they have to pay out of pocket for their pathology, they have to pay out of pocket for their imaging, and all of these result in further delays to their diagnosis. And then once the treatments start, they still have to continue paying in order to support the entire treatment journey. Now, all of these translate into delays and ultimately more advanced stages of cancers and diagnosis. One of the other major barriers to care, something that we don't often talk about enough, certainly, is the social cultural barriers that exist around cancers. Now, regions where I work and practice, there's definitely, we see quite a lot of fatalism, and there's also a lot of stigma around cancers where patients are discriminated against. Had a couple of patients who've lost their source of livelihood. There's also sometimes lots of misunderstandings and misconceptions around cancers.